Namaste, friends. I'm Dr. Rupa Shah. Good morning, good afternoon, and good evening. From wherever in the world you're watching me today, my topic today is what about my calcium? Let me start by sharing my PowerPoint. So, whenever I tell people that dairy is not good for health and one should try to give it up completely, they are ready, they're inspired, but they start asking me a question very soon. But what about my calcium? So today's talk is exactly about that question that I'm asked over the last few years, maybe hundreds of times. So before I start my presentation, I would like to introduce myself. I am a medical doctor. I have an MBBS degree. I'm a holistic physician for more than 38 years now. I'm also pioneer of Indian flower remedies along with my husband Dr. Atul Shah. I am author of several books on plant-based diet in several languages. I'm a public speaker and I am also a plant-based lifestyle promoter. Before I begin my talk, I would like to disclose and disclaimer. The information shared is not intended to replace the advice of your medical practitioner. Please inform and discuss with your medical practitioner when embarking on lifestyle changes. Now, in today's talk, what we will learn: importance of calcium in our health, what are the health issues with calcium deficiency, what are the causes of calcium problems, what are the best solutions, and finally, what are the resources available to us. Of course, calcium is one of the most common element found on earth. This is the periodic table representation of calcium. What is the function of calcium in our body? Of course, everybody says bones and teeth, but there are also some other functions where calcium is very important. It controls the muscular contraction of our heart, including our heartbeats. Of course, the muscle contractions are with calcium. It also controls the blood clots. It is also important in nervous transmission. How will you identify if you are calcium deficient? Signs and symptoms of calcium deficiency are just watch your nail right now. And if you have a white line like this, then very likely that you have calcium deficiency. What are the symptoms of calcium deficiency? Are you getting tired? Are you depressed? Do you have some tingling, numbness in your hands and feet? Are your teeth which are decaying? Do you have memory loss? Do you have frequent illness or constant sleep problems? Your bones are weak, fragile. You have very poor appetite. Your teeth are discolored. You have a lot of aches and pains in various muscles of your body. And at what age calcium deficiency start? Do you know that? It can start as early as childhood when a baby is teething and is having this kind of condition. We call it as pica, where they are just eating wall coverings, mud, or chalks. Osteoporosis is now a very, very common condition. Here I have shown a picture of a woman. Usually she is postmenopausal. Here are the pictures of normal bone, osteoporotic bone, and if the severe osteoporosis is there, then you can see the bone structure is very weak. Here is the calcium and arthritis link. There are calcium crystals in various joints, and that also can give you a lot of pain. You also have link of calcium with blood pressure and, as I mentioned before, with your heart health. Here is the article that was carried by Times Magazine on heart attack, and there is clear mention that there are plaques in your arteries where the calcium gets deposited, and that's the cause of your heart attack. Here we measure what is called as calcium score, and higher the calcium score, more you are prone with heart attacks. Now let's go on understanding about what are the causes of calcium deficiency. And it is also called as hypokalemia in medical terms, calcium deficiency disease. So why calcium deficiency happens? Number one, poor dietary habits. Number two, lack of exercise. Number three, medications like steroids, anti-acidity drugs, laxatives, chronic kidney diseases, hypoparathyroidism particularly, lack of sunshine, alcohol. Yeah, alcohol addiction is definitely very, very important. Coffee, caffeine, all those drinks that has caffeine will reduce the absorption of calcium, and it also increases the calcium loss. Gut disorders. If you have some gut disorders, then also there is calcium deficiency. When there is very low protein in your diet because of some liver diseases or infection, and then there are some rare genetic disorders where calcium deficiency also happens. How much calcium do we need daily? Daily calcium requirements for 1 to 9-year old, for boys and girls, it's 600 mg. 10 to 12-year olds, in girls, higher, 700. 13 to 15-year-old boys, again, now it's higher because the growth is happening. 16 to 18-year-old, it's the same, 600 for boys and girls. And then from 19 to 50-year-old, 600 mg. And then 19 to 50, but if you're pregnant, if you're breastfeeding your baby, of course, your calcium needs are much, much higher. That's in women. And 51-year onwards, it's 600 mg. This is taken from Nutrition Foundation of India. Now, you must have heard about menopause also, where the calcium needs are higher. So here, a woman needs calcium more during pregnancy, lactation, and menopause. Because at menopause, there is decrease of estrogen level, and this has effect on your bones, and that is why the osteoporosis risk is higher in women after menopause. Children, of course, when they are teething, as I mentioned before, have higher needs of calcium. Of course, which vitamin is associated most with calcium? Everybody answers it's vitamin D. I know it is the sunshine vitamin. But there are also other vitamins which are very important, and that's vitamin A, B, and C. So just remember A, B, C, D. All these vitamins are associated with calcium. So let's talk about vitamin D briefly. It is the sunshine vitamin. What happens if you don't have enough of vitamin D? These days, I see across the board Everyone, almost everyone, is deficient in vitamin D. No matter what, how much of the sunshine we get, somehow this is our modern lifestyle issue. And I see people with always lower vitamin D levels. So it's very important that you regularly check your vitamin D, and if required, of course, you may have to take supplements. The symptoms of vitamin D are bone pain, digestive tract problems, muscle twitchings, tiredness and fatigue, and sweating. Now, the normal range is usually 30 to 74. If you are less than 30, then we call it as deficiency, and less than 10 is more deficiency, but less than 5, or sometimes it's even lower, is severe deficiency. Of course, as I mentioned before, vitamin C is also very, very important for our calcium needs. Calcium absorption is enhanced when you have vitamin C in your diet. There are other elements that are required for calcium absorption. They are phosphorus, magnesium, potassium, and zinc. These are friends of calcium. They should be always there along with calcium. Now, when should you take a bone density test? Usually, we recommend on various conditions. If you are prone to fractures, repeated fractures. Recently, I heard of a patient who had multiple fractures in a year, and then we had to get the bone density test done, and there was osteoporosis. So that's the reason why you should get your bone density test done. But if you are above 45, if you're perimenopausal or already menopausal, then you should get your bone density test done. Women of 65 years and older, yes, it's important. Get your bone density done. Men of 70 years and older, if you break a bone after the age of 50 years, maybe you should get this done first. If you have constant back pain, joint pains, or you don't have energy, get this test. And it should be repeated once in 2 years. Serum calcium test is a blood test that is done. It can be done once in a year, but there is also a better test that I usually recommend, which is called as ionic calcium. So serum calcium is not sufficient. You should get ionic calcium done. This is the exact measure of calcium in your cellular level, ionic calcium. Of course, X-rays tell us also quite clearly when you have fracture or you had some other condition, and that's why you got your X-ray done. And if your bones are osteoporotic, they will be seen like this with lot of darkness in it. You see on the left is the one which has got enough calcium, and then one on the right side shows that there are osteoporotic changes in your bone. So, what will you do if you have less calcium? You go to your doctor and they will immediately prescribe you calcium supplements. What are the issues with calcium supplements? So, sometimes the calcium comes in the supplement in a form which is not absorbable because it does not have some of the cofactors. Like I said, friends of calcium. The cofactors are the nutrients that shuttle the calcium into the bone and then helps the bone and teeth mineralization. So those cofactors should be there in your supplement. However, there are some issues with calcium supplements. Some people get some side effects of calcium supplements, and some supplements can be actually harmful. A study done and published here, I have given the note, says that there are some issues with the calcium supplementation. And this is the link here. You can go and read it up and read in detail all about it, and be careful before you embark on taking the calcium supplements. Here I have this hypothesis that when calcium is taken in the supplement form, sometimes your body cannot figure out what it is. We call it as nutrients without the exact address. However, when you take food which already has calcium in it, we call it as nutrients with exact address. It knows how to get to inside your body, which organ, and how it gets assimilated. So it is the nutrient with exact address in your body knows what to become the bones, teeth, and wherever it is required, it goes. But if you take supplements, probably your body is confused and do not know how to assimilate it. Now, what food comes in your mind when we think of calcium, right? You go on Google and you look for foods that have calcium sources. Here is the common picture that comes up on your screen and is written that calcium rich food. And you can see that it has shown dairy, lots of green vegetables, almonds, tofu, cheese, also fish, practically almost everything. And there are sprouts as well. There's meat. All these are shown as the sources of calcium on the internet when you Google. However, what are the issues? The number one is the dairy. Usually, we associate dairy with calcium. When someone tells us to stop dairy products, we are immediately worried. Arey, what about my calcium? Where will I get my calcium? My doctor told me to take 2 glasses of milk every day, and if I don't take, I'll get osteoporosis. So we associate dairy with calcium. And I fully understand this from where this concept comes from. Here, I would like to mention why dairy is not a good source of calcium and what are the issues with dairy products. Casein in milk is now linked with cancer. There are certain growth hormones that is not good for your skin, causes acne, eczema, psoriasis. Actually, dairy is linked with chronic diseases like osteoporosis, heart disease, and diabetes. Calcium from milk is poorly absorbed compared to a plant based calcium. The lactose in the dairy product is not digested properly, and many people get gases and they feel uncomfortable when they have dairy products. And of course, we say the logic that we are not baby cow or baby calf, and therefore the composition of milk is only suitable for the animal of that particular species and not for us. So, only on this planet, human beings are the only beings that have milk of other species. No other species are drinking the milk of another animal. Also associated with weight gain, there is inflammation also, and there is high saturated fat content. Milk is also coming with saturated fat and it has link with cholesterol numbers and therefore increasing your cardiovascular diseases risk. Of course, there are other dairy alternatives available which one can think of, and cheese is having a very strong effect on our brain because it contains casomorphin and it is very addictive. Here is the chart that I have taken from this particular website that is showing you the various nutrients in various plant-based milk and compared with the dairy milk. Here I want to point out straight away just one of the most important one, that is the last line, which is dairy milk, calcium 120, soya milk 120, almond 120. So now you can see that there's sufficient calcium in plant-based milk. So you need not worry, where will my calcium come from? There's another issue associating animal products like meat, fish, and eggs with calcium. But there are problems with these animal products. They contain no fiber, they are higher in cholesterol, there is antibiotic in some of them. Also, sometimes the pesticides are there. Uh, the bacterial count is very high, and it is acid forming foods in our body. This is the chart that shows that higher the animal protein, chances that the calcium loss is more in our body. And that is the reason why osteoporosis is happening in those countries where people consume a lot of animal products and dairy products. Nutritionfacts.org is the website to go for and look for articles, research articles regarding calcium. Here you will find complete information about calcium supplements, whether they are safe or not, acid alkaline balance, whether the calcium loss happens because of higher animal protein. So, in case if you want to read in detail, this is the website to go for. There is another website that is called as plantbaseddata.org, which also has wonderful information on calcium and how the plant-based diet is actually better source of calcium. This is I have taken from Dr. McDougall's newsletter. Here also it mentions that higher the quantity of, there's a study that says that higher is actually the fracture risk. So this is quite contrary to our knowledge that you must drink lots of milk so that your bones become healthy. So do go through it, read about it if you are interested in details about it. It says that the protein content of the milk supplement may have a negative effect on calcium balance. This is from a Cornell Chronicle, that is uh, uh, Dr. Colin Campbell, who has written the famous book, The China Study. And this article is from there and says that eating less meat may help reduce osteoporosis risk, and study shows. So, this is article. So, analysis of these data suggests that increased level of animal-based proteins, including protein from dairy products, almost certainly contribute to a significant loss of bone calcium, while vegetable-based diets clearly protect against the bone loss. This is Dr. Campbell has reported. This is the chart that shows that nutrient composition of plant-based and animal-based foods. And again, you can see actually the plant-based foods have much, much higher calcium. So you need not worry about your calcium. It also has no cholesterol. Plant-based foods, no cholesterol. Animal-based foods have cholesterol. There are other issues like vitamin C is very low in animal-based products. Here, for our calcium, we need vitamin C. It's already there in plant-based food. You also see beta carotene, which is far, far higher in plant-based food. You need magnesium, it's much higher. You need iron, it's much higher. So plant-based foods are superior in your nutrient supply. And don't bother about protein. It's pretty much similar in plant-based food as well. Now, calcium from kale is more bioavailable than calcium from milk. So, what is this issue of bioavailability? So, although someone will argue, oh, milk has calcium in it, but is it bioavailable? So, here is the study by School of Public Health that is published, is talking about the bioavailability of calcium. The bioavailability of calcium in plant-based foods is much higher than in animal-based food. So here is the study that suggests. So eating 1 cup of cooked bok choy, that is similar to some of our greens like palak that we have, has almost as much bioavailable calcium as 1 cup of milk. So please don't worry about your calcium. It has to be more bioavailable. There are certain anti-nutrients which are called as oxalates and phytates you need to be careful about. So you combine your calcium with this kind of foods like all your greens that contains oxalates and phytates, then your calcium may not get absorbed. But however, as I said, don't worry, the calcium in plant-based food is definitely more bioavailable and it will supply you enough of calcium. This is the British Medical Journal that says that high milk intake is associated with increased risk of fractures. Think about it. It's quite contrary to what we have heard over and over, again and again over the years. However, more research data is required. We are in a very nascent stage right now. Whatever data I have presented is only available so much at the moment. More research needs to be done. As we gather on these kind of platforms, more and more doctors will share data and we will be able to speak with more confidence why plant-based diet is sufficient in our calcium needs. Now, a question. Where does a cow, buffalo, elephant, and a horse get his calcium from? These animals are very strong. Horse, elephant, they all get it from plant-based sources. They are vegan and they already get their calcium from the grass. So let's just think about what are the best sources of calcium in plant-based foods. Here, number one are sesame seeds. Sesame seeds are really the champion, hero. I usually recommend everyone to add some sesame seeds in your daily diet. Then you have flax seeds and you also have amaranth seeds. Amaranth seeds are, we call it as Rajgira in India. So these are our humble, very, very easily available calcium rich sources in Indian market. Do include these in your daily diet. Then we have Nachni, the most famous millet. Nachni, very good when you give it to small babies in the form of porridge or even older people. Include some amount of nachni, also called as ragi. Maybe make chapatis or whatever, but do add it. And of course, oats. Oats are the famous one that we use quite regularly. Then, of course, all these lovely greens like turnip greens. People throw away these greens and just buy the bottom part, the turnip. Rajgira leaves are available. Don't throw them away. They are very rich source of calcium. And greens from the beet. We eat beet, but we forget the humble greens. So my sabji wala, I always tell him, please keep the greens for me. I will take and I make juice out of it. Then, of course, we have drumstick leaves and curry leaves. Curry leaves are routinely used in South Indian cuisine. We make chutney out of it dry, and it's very good supply of my calcium. And of course, you can use the drumstick leaves in form of powder if it's not available as fresh leaves. Then, of course, these are routinely used various pulses, beans, rajma. In the North India, soybeans, all soy products, chana, of course, and in Maharashtra, we use kulthi or horse gram for making pitla. These are wonderful sources of calcium. Then we have coconut palm jaggery and sago palm jaggery. These also hold a lot of calcium. Of course, then our lovely fruits. On the list are figs, oranges, apricots, dates, prunes, mulberries. Prickly pears, we call them as finla. Wood apple, lime peel. We make herbal tea with this. Kher in Rajasthan and sangri. Kher sangri is a very famous Rajasthani sabji. Then, of course, all anything that looks green has some calcium in it. So all these greens, some in the form of smoothies or salads, or just sprinkle them or just have them as it is. Here, I wanted to just quickly mention this case of this little young boy who had a very rare disease called as osteogenesis imperfecta. This is supposed to be a very rare genetic condition. This boy had multiple fractures, very easy, just a small fall and he would have fractured. And he was shown to so many doctors. And finally, his father, Pratik Vyas, decided to try raw foods. And he started with all the fruits and greens and vegetables and juices and gave up the dairy products completely for his son. And within few months, all his bones became totally normal. His growth is totally all right. He has no more fractures. And it has been a few years. His entire family is following plant-based diet, and his complete video is there on my YouTube channel, Circle of Health. Do listen to his story, and there are also many other videos on him on internet, on YouTube channel, and he has also helped many more such patients with osteogenesis imperfecta, where the bones, just have very fragile. And what a wonderful rescue for this boy. So, no dairy and only plant-based food, and look what wonderful results. Also, when you take more plant-based foods, then your acid alkaline balance is well maintained, as all plant-based foods are more alkaline, and then you have pH maintained. So all the junk foods, all these processed foods are acidic, and all the foods that are made by nature, grown in nature, are all alkaline foods. So if you want to maintain your acid alkaline balance, then go plant-based. Now, a few samples of some of the recipes that we regularly use in our daily diet, and that should be sufficient for our calcium food. So, nachni, porridge, maybe sesame seed laddu, maybe a chutney from curry leaf, maybe almond milk or tofu or soy products, maybe a green smoothie where you have radish leaves or some such leaves, and your beans, chana, all these are sufficient. Just use them in rotation. Keep paying attention. If you don't have calcium rich foods, just add them on your daily diet. Just make a little list. I must have these in rotation every day. Here are some of the common recipes that we are already using, and I wanted to mention about the calcium content. So 1 cup of whole milk has 275 mg possible calcium in that milk, but half cup of almond butter has more calcium than this cup of milk. Half cup of tofu, when we make tofu bhurji, I easily have more than half cup, and that has more calcium than 1 cup of milk. You have 1 cup of soy yogurt, or we make lassi, it has more calcium. 1 cup of oats has more calcium than 1 cup of milk. And then finally, 2 tablespoons, just 2 tablespoons of sesame seeds has sufficient calcium as 1 cup of milk. So all that you need is 2 tablespoons of sesame seeds in various recipes throughout the day. Now you must have good digestion. If your digestive system is not good, then you cannot have strong bones. So pay attention to improve your digestion. That's very basic. You should be able to digest all the foods coming from plant-based sources. Then only you will get calcium. Also, premenstrual tension and painful periods are also linked with calcium. You may have fatigue, some food cravings, and also depression. So, if you're suffering from this, think about calcium rich foods. There are also lots of symptoms of menopause like hot flushes, night sweats, joint pains, headaches, mood swings, vaginal dryness. All these are associated also with calcium in our body. Now I want to quickly show you simple plan for 3 days, and you include these in your daily diet. Take a screenshot of this while I'm talking, and this will help you a lot. So in your breakfast, maybe add nachni or kuttu, which is also good source of calcium, or kulthi, as I mentioned about horse gram, you can make a chila out of it, or some tofu item. You can have tofu bhurji or tofu paratha, or any such combination. Then have one green juice every day. So that's like your turnip greens, moringa leaves, or beet greens. Then you have fruits like oranges, figs, dates, apricots every day in rotation. Then chutneys. Keep these chutneys ready. Curry leaf, sesame seeds, of course, are very commonly used in Maharashtra, and coconut. Add veggies like gawar. Just this morning I had gawar sabji, then bhindi, of course, good source of calcium, carrots, and lotus stem. We call it as bhe. Then kala chana, beans, rajma, white beans in rotation. Maybe today, then tomorrow something else. Then almond milk, soy milk, sesame milk with coconut milk combo. Any of these can be added. Then you can have some mixed seeds like flax seeds, sesame seeds, and just have like mukwas or munching, and makhana pops whenever you are hungry anytime. So these are the foods that you just write down, add them, and your calcium needs will be met from your plant-based sources. Now there is a high calcium recipe. So let me see if I can play and you all can pick up from here. So apricots, figs, tamarind, you soak them in water. We call it as amli. Soak them for about 8 hours. There's dates, figs, and apricots. Keep some cashews ready. You also need fresh coconut, about 70 gram of this. Now you can see that all my ingredients are ready. After 8 hours, I have not soaked cashew or coconut. All other ingredients I have soaked them. So mash the tamarind and strain it. So this is the strained tamarind water. You remove the seeds from dates and apricots. Now I have a nice high-speed blender. It's called as NutriBullet, but you can use any such blender and blend all this together. Now you have to add coconut and blend again. Finally, you just use some of the cashews on the top to garnish, and this quantity is enough for making 2 glasses. And it's a very rich, heavy drink to digest. So when you have this drink, don't eat anything for 2 or 3 hours before, after this, so that your stomach is ready to digest it. Okay, let's go over to the next slide. So I also wanted to give you 3 bonus juices. The one is called as white pumpkin or petha juice. The second one is durwa grass. And third one is curry leaf. So you can make juice from this and have it. Many people have not heard of durwa grass. This is offered to Ganesh ji for puja. And this is quite easily available, very cheap it is, and is also good source of calcium. You must do some exercises. Just taking calcium in food is not enough. Some weight bearing exercises, some physical hard work is very important to make calcium move inside the bone. So I inspire people to include not just routine housework but some exercises so that you now have very strong bones. So calcium, vitamin D, and exercise. Calcium rich foods from plant based sources. Vitamin D is your sunshine. If you don't get enough sunshine, then you take supplements of vitamin D and exercise. These are the most important for your bone health. If you are not getting sleep in the night, remember it's your calcium and magnesium. These two ingredients you have to increase in your diet. Calcium also has link with weight loss. If you are unable to lose weight, then think about adding calcium rich food in your diet. It helps you to burn more fat and you can start losing weight very fast. Calcium is also associated with immune system. Please pay attention. If your immunity is down, you need calcium for repairing the injured or damaged tissue in your body. You pay attention to calcium. Finally, I believe in holistic health and holistic approach. It is the mind, emotions, and body. There's a complete link. We have to be also happy, positive, active, and emotionally stable. Then our healing is complete and we continue to remain healthy and we prevent diseases. So as part of the holistic lifestyle, this is also part of calcium friends. It's not just calcium alone. Although I speak today about calcium, I generally do not like to speak about a single ingredient because we are not separate from the rest of the universe. So, calcium is also not separate from the rest of the different nutrients, chlorides, sodium, potassium, phosphorus, magnesium, sulfur. All these are also in interplay with calcium. So don't always worry about calcium alone. Whenever you take whole food plant based diet, all these friends come along and make everything happen in a very holistic way. Here is the picture that shows that calcium has a very strong relationship with phosphorus. Now, so in final conclusion, my advice and my understanding of these years is like this: choose whole food plant based diet as far as possible. If you can't do whole all the time, at least try and remain plant based. Whole food is always more beneficial. Reduce your junk food intake because junk foods are the biggest trouble. Eat more greens, eat more beans, exercise daily. Eat, I always say, eat your sunshine. Go and sit in the sunshine. 20 minutes minimum, more is better. Maybe 40 minutes. Early morning, not necessary. You can also sit at 10 o'clock, whenever you get. Expose your body to sunshine. Then stop all these acid increasing foods like colas, soft drinks. They are the biggest culprit. I don't even call them food, they are food like substances. Chew your food very well. That's also, of course, very basic to helping our digestion. And try to eat calcium rich, natural plant food every day. These are the simple best practices that I follow in my life. It's not complicated, it is just very simple. I have written this book called as What About My Calcium, and also Dairy Alternatives. Dairy alternative books are available in three language. Gujarati, it is called as Vanaspati Janya Doodh, Dairy Alternatives in English, and Vanaspati Janya Doodh in Hindi. These have basic dairy alternative recipes. It's really like a little guide which is very useful for our Indian cooking. Those who are outside India, they can actually purchase ebook from Google Books. This is the picture of the book, What About My Calcium? That is having an extensive chart of calcium rich foods from plant based sources. And you can plan your recipes every day from this book. And there are some wonderful 30 basic recipes. Those who have used this book, my friend Neha Mudra has sent this beautiful kulthi pitla that she made. She lives in Maharashtra, but she had never tried this. You can also make a Jain version of it, just like this. Here are the testimonials of people who have tried the recipes from the book and have got benefited. These are my websites that you can visit. You can buy the books, you can read more articles on calcium, and I also promote natural lifestyle. So, in case if you want to know more about it, here are my email, websites. I'm also on Facebook, Instagram, and YouTube. And you can also join my group on Facebook. If you have any questions, do write them in the comment section. I will read them and answer them as and when I can. Those who want to see this talk again, replays will be available for next 15 days. So thank you very much for attending my talk today, and I'll see you all soon. Namaste.